Thank you to everyone for joining today. Just an opportunity for everyone to kind of hear a little bit more from the co-founders, Charlene and Katie, who I'm sure are very eager to answer any questions or just have a chat with anyone that's got anything that they want to discuss regarding the crowdfunding campaign and the investment in the organization. We're going to have a little presentation delivered by Katie and Charlene, and then leave some space for Q&A or anything else that you guys wanted to raise or discuss. So on that, I'm going to hand straight over to Katie and Charlene.
Hi everybody, I'm Katie Bell. I'm the co-founder and CEO of KidneyBeam, and I'm a software engineer by background. So I've been in the world of technology startups for the last 17 years and dedicated my whole career to building technology products that have a meaningful purpose for people's lives. And I'm excited to answer any questions we have about the investment today. So I'll pass over to Charlene.
Hi everyone, I'm Charlene Greenwood and I am a kidney physiotherapist by background, and I am co-founder and chief medical officer for KidneyBeam, and I have spent the last 22 years working in the field, directly working with people who are living with kidney disease, developing research and clinical solutions, and very excited to share what we've been doing with KidneyBeam with you today. I'll hand over to Simon to introduce himself.
Yeah, good evening. My name is Simon Lupit. I'm a retired entrepreneur, commercial advisor to KidneyBeam, and I suppose I'm really the grey hairs in the team to blend a little bit of aging experience.
Lovely. And Mel?
I'm Mel Bernardo. I'm head of operations at KidneyBeam, helping make all of Katie and Charlene's wonderful ideas move through to fruition and working with them day to day.
Lovely. So I'm just going to spend the next few minutes. Katie and I will introduce KidneyBeam, which is a kidney-specific exercise and lifestyle management app. So I wanted to start off by telling you a short story. So I want to tell you about John. John is 86-year-old. And he has chronic kidney disease. He's approaching end stage where he's going to need dialysis treatment. And he reports that his mobility is getting worse and he's really struggling to get up and down the stairs. Now, if John had a cardiac or pulmonary or even a cancer diagnosis, he would receive routine specialist rehabilitation. But because there's only 3 out of 72 kidney units in England that offer any type of kidney-specific rehab and no skilled workforce to really deliver more, people like John aren't able to access that routine care that they so desperately need. And that's why we have developed KidneyBeam. So KidneyBeam is a scientifically proven app delivering kidney-specific exercise and lifestyle management. We offer evidence-based, live and on-demand classes and content that is tailored to people who are living with the condition at whatever stage of kidney disease they are at. And we're able to deliver this in a way that is comparable to face-to-face kidney rehab, but significantly cheaper than delivering face-to-face care. Our 340-person randomized controlled trial, recently published in The Lancet Digital Health, has shown that KidneyBeam is able to significantly improve health outcomes for patients while being a cost-effective solution to improve mental health-related quality of life in people who are living with kidney disease. We've been working with all 8 NHS England renal networks to deliver KidneyBeam to 3,000 people in an implementation trial. And we've developed really important partnerships and have discovered important insights into the delivery of KidneyBeam, which will allow us to do a fast scale into the NHS post-funding. And we've been on quite a considerable journey since we first started out in the middle of COVID. And where we are at the moment is that we're just about to finish our Digital Health London Accelerator programme. And we're excited also to announce that we are one of only 12 out of 200 companies that have been chosen to participate in the NHS Innovation Accelerator over the next 3 years.
So we operate a B2B2C business model where we sell our service for a fee to healthcare payers such as the NHS and health insurers. And in the future plan to make B2B sales as we build data partnerships with industry partners. Our growth, so to date, we've been concentrating on the UK market, preparing for national commissioning within the NHS, which we feel will, which we plan to get to in 2025. In the US, we're already in talks with Geisinger Health and the National Kidney Foundation, who we're planning to partner with on a grant-funded US clinical trial and commercialization in 2027. And in the EU, already got conversations going about smaller country-specific pilots ready for commercialization in the future. This covers a lot of what I've just spoken through, but just to put this on a map, we have pilots running in Ireland, Canada, and so Ireland and Canada active pilots running. At the US, those conversations are going on, and we have plenty of other conversations going on. Italy, Portugal, and Spain being hot ones that we're likely to take forward, and just expansion, lots of interest throughout the country, throughout the world. So myself and Charlene and Simon introduced ourselves earlier. We're also kindly have advisors, Ashley, who's joined us as an AI and business strategy expert, helping us as we implement AI and machine learning into the product, and Pamela Scarborough, who has a digital health background and lots of years of experience to help support us as we grow. We are currently raising a crowdfunding to raise £600,000 to £850,000, and that is to complete a UK-wide rollout and reach national commissioning in the UK. That's our primary focus here, and to further develop the product to commercialise outside of the UK. A lot of information to take in here, and our full pitch is available on the crowdfunding website. But just to highlight a few areas, we estimated to surpass 1 million users within 3 years, to hit revenues of 4 million by Series A, and to have an estimated revenues of 30 million within 5 years' time. So why invest in us? Well, we have developed a first of its kind virtual healthcare platform addressing an underserved kidney-specific market. We have a trusted partner of the NHS already on board, a community that is designed to improve the quality of life for people living with kidney disease. We've built a defensible technology platform that can scale geographically and to other health conditions. And this is an investment opportunity that addresses a social need as well as financial returns. So to invest, we have launched our crowdfunding campaign on Crowdcube. Not a great URL there, but if you just search Kidney Beam on Crowdcube, you'll find us. And we are raising this under an ASA. And for those of you that are not familiar with that, an advanced subscription agreement is an equity instrument where investors prepay for shares of a company. So investors hand over the money, but they receive their shares when these are issued at a future date. So the key terms to that are long stop dates. So we'll be raising the 1 million, which is the qualifying amount, 1 million within 6 months' time. Our default valuation, so if we hit that 6 months without having raised and set our valuation within that 6 months, our valuation will be at £4 million pre-money, and the discount on that ASA is 20%. So if we do go on to raise that full million of the round and the valuation being set, investors that invest on the ASA will have a 20% discount on that valuation. And this is the portion of Q&A. Very happy to answer any questions that people have. And yeah, thank you for listening. That is the plan, but with the full 1 million, which we're trying to raise. So that's the target. We'd be targeting raising that full million within the 6-month period of the ASA. So that would give us the 18 months. Otherwise, we'll be looking to stretch that money out to get to NHS commissioning. Our number one is to reach NHS commissioning. So with that will come sustainability and ability to grow. We just can't grow as fast. The two major things that we will be investing in first off is a commercial person to come on board to help us with the sales into the NHS. So myself and Charlene have, learned a lot in terms of commercials in the NHS, but we need an experienced person on our team to do that, knocking on the doors and making the sales into the NHS. And secondly, for me, it's improving the product, the usability, and addressing the usability issues that came up as part of that came up as problems with the platform as part of the research study that has been conducted. But Charlene, what's your first?
I think exactly. I think the commercial side is incredibly important. We're at a very exciting point in time where the standards of care for people living with kidney disease are being revised. There will be a requirement for there to be access to specialist physiotherapy and renal for the first time. We also have a new clinical policy, which is sitting with the clinical policy unit with NHS England, which will also see this specific type of intervention hopefully being a requirement to be offered to people who are living with kidney disease. So alongside that exciting opportunity, we need to have in place the team that's ready to help deliver and scale. So that's my absolute priority, and but the product will need to be able to scale and do what it needs to do alongside that. It's been beyond exciting to go round and talk to people who are living with the condition at various different patient conferences, and we have a really good understanding about the content that we want to continue to bring on, and especially from a commissioning point of view, and to meet the needs of what clinicians have been asking. We will soon be launching a post-transplant programme, but we're also going to be looking to develop prehabilitation, which will be preparing people for dialysis and kidney transplantation, as well as working on specific content around dialysis, home dialysis, and also quite a unique one. We've been asked specifically to produce male-focused content for post-transplant abdominal exercises. So I was really excited to have had so many people asking for that. So we want to be able to work in a really efficient way to continue to bring on important content, so we stay relevant and fresh and are able to maintain people on the platform. So NHS commissioning, we're at a point in time where centralised commissioning is being devolved down to regional commissioning, and this is where population health will be commissioned, and with revised standards, which, as I mentioned previously, soon to be published, but also this new clinical policy, which we have the evidence base from our randomized controlled trial showing that it's a cost-effective solution to improve mental health related quality of life and other important patient outcomes. We want to work together with commissioners to commission Kidney Beam for everyone who's living with kidney disease in England, and then expand out further into wherever else we're needed, really. So that's what it means for Kidney Beam. For investors, it really is, it shows that we will be sustainable. We have in place a strategy, we have the partnerships in place, we have the necessary roadmap to get us to that point. We've also developed some incredibly great partnerships with the different regions, the London Kidney Network and other regions. So we will be hoping to continue to improve our product together with different regional needs and hopes and desires from there, and be able to work with those partners to commission the product. So for investors, I think it gives some assurance that this is a good place to place investment.
our next large market would be the US. So we are already in conversations with Geisinger Health System over there, with the National Kidney Foundation, about partnering on a US-based clinical trial, which we believe will be needed for reimbursement over in the US. And we have conversations going on about potentially Italy, Portugal and Spain are our next three, which we have strong connections to, that potentially we'll be starting pilots with in the next year. So yeah, plenty of other conversations going on all over the place. It's about focusing right now on what we need to do to get to the next step of sustainability, really. And whilst we would love to expand very quickly, we've got to stay focused, and with this investment, stay focused on the UK market before expansion.
With companies that have EIS, you can offset the initial cost against your income tax. So essentially, it's an income tax deduction. And then, provided the investment is held for 3 years, you also get any gains come to you free of capital gains tax. In the unfortunate, unlikely event that the business is not successful, you can also then write off the residual amount you haven't already claimed against any other tax gains. So in principle, mathematically, I think it works out as the maximum loss is about 38%. So less than a bad day on the London Stock Exchange, but you get the benefit of investing in a really exciting opportunity.
Just an update to say that we're at 88% of our target, which is £600,000. So we're very close to getting there. So we appreciate that some people might be waiting for towards the end of the crowdfund, but it really does help for people that are interested to go ahead and make those investments, to keep on pushing that number up and up and up, so we can be successful. And yeah, we'd welcome any future questions, obviously directly on the crowdfund. You can or get in contact with us in any which way, email, to have any onward conversations if anything's not clear. We do know that some people have had issues with the Crowdcube site not being as intuitive about actually making the investment. So if there's any blockers there, we're also obviously welcome, and very happy to help with hand-holding anyone about making those investments. And from a charity perspective, we do have Kidney Research UK and the National Kidney Federation on board as charity investors. So that is also a possibility for charities to invest into this, which of course we welcome wholeheartedly.
Absolutely, and we'll also be putting out the update as soon as we have heard from HMRC. I have had a few people who've reached out to say they're waiting on confirmation of the status to confirm or to convert their pledge into an investment. So just to be assured, as soon as that comes through, we'll be letting people know. We may extend the time that we're live in this crowdfund, just to allow for a bit of slippage. We're beholden to the HMRC for their timescales in terms of coming back to us, and we do want to give people the opportunity to be able to invest with the assurance that that EIS is in place. I've been assured that our application is not complicated, and we have put this in through Seed Legals, who are very adept at putting in these applications. So I'm not expecting there to be any problems, but I do understand that some people are looking for that assurance before putting in their investment. But I would just like to really draw to a close and just thank everybody for taking their time today. I know there's going to be people who will watch this recording back, and I would like to just say that I think we're an exciting company. We're very driven. We have a good track record, and we know what our strategy is to make this business a huge success here in the UK and wider. So we do hope that people will see those benefits and take the opportunity to invest in us. So thank you very much for your your time, and hopefully you get to enjoy a little bit of the rest of this summer evening that we've got out there.